what we're going to do is access this and get a blood specimen from it. So you would access it like I already showed you, okay? So this will be closed, and we'll start from the beginning. I'm going to come in, I'm going to do my 9 safety practices, right, with my patient, make sure everything's good there. I'm going to wash my hands, okay? If you guys want to come closer, I don't know if you can zoom in on me, but if you want to come up here closer, that's fine.
Go ahead.
I got tickled at one group the other day, they were videotaping this part of it, and one of the students, her phone kept falling, she kept dropping it and falling off. It fell from over the floor once. We were cracking up because it just was like, it was not meant for you to videotape this. But we had others videotaping, so it was cool. All right, so anyway, so I'm going to come in, do my 9 safety practices, and I'm going to wash my hands. I just believe you should wash your hands, okay? Then once I've done that, I'm going to mask everybody in the room. All right, so I want to get everybody masked up. I'm going to mask the patient. I probably forgot to tell you. Mask your patient, all right? And then turn their head away from wherever the site you're going to be working from, okay? So I'm going to be over here, so I'm going to have my patient turn their head toward me, all right? And then what I want to do is just find the port. Where is it? I don't know where this patient's port is. I know it's somewhere here, right? But I don't know exactly where, and so I'm just going to palpate until I find the lump there, and I've got their port. All right, so then once I do that, I'm going to get my Huber needle ready. So it's going to come in its little pack like this. And like I said, the oncology nurses taught me to just open that one corner up there, and then just push on your cap and your regulator, and you'll be able to push that through there, okay? And so once you got your cap through there, take your cap off. Don't touch this part of it, all right? That's got to remain sterile. So we're going to set that upright on our table, and I just kind of push it back there, okay? Grab your first saline syringe, and this is what we're going to do to purge our line because it's got air in it. So I'm just going to push, okay, and get about 5 cc's out of there and make sure there's no air left in there and I see fluid in the bag, okay? And then just take this, all right, and just set it on there, the whole thing, just set it down on there. So then the next part, once I got my Huber needle ready to go, I'm going to access my kit, and everything else then in there, and for me, is in the kit. And so turn it to where the peel part, turn that always away from you in this type of kit, and then open back to you, okay? And then that way you're never over top of anything. Okay. And so then what I'm going to do is take my first leaf, and it should open away from me, and then my left, and then my right, and then back to me. And then you've got that little 1-inch border there that you can pull. I just always pull that down so I get it out of my way, okay? So it's not sitting up like that. I get it down out of my way. Remember, I don't have my gloves on yet, right? Okay? So then the first thing that's going to be on top will be your mask wrapped around your gloves, right? Remember that? So you're just going to grab that out and take the 2 white ear loops and just pull them over like that, and then it will release. You can put your mask on, and then you have your gloves, and you'll set your sterile gloves over there, and then go over here and put your sterile gloves on. Okay, so open them up. Got my sterile gloves on. Prayer position, come back around. Now, everything in here, all this is sterile, okay, inside, so I can just go to work. Okay, so I'm going to get my first 3 alcohol swabs out. I'm going to rip those open to where I can get to the stems. Pull my first one out, start right on the portacath, and we're going to scrub that for like 4 seconds, 5 seconds, whatever you feel. Okay, and then work my way out as big as my dressing is, and do that for 10 seconds. Throw that biohazard. Get the next one. Same thing. 4 or 5 seconds. Good scrub there. Then start working my way out. Slightly bigger than my dressing. And then take the last one. Scrub it good. And start working my way out. So you did it 3 times for a total of 30 seconds. So all that would be my biohazard. So then I'm going to reach in here and get my next thing out, will be my CHG, chlorhexidine gluconate. And I'll go ahead and break that, press on the little wings right there, and you'll hear the crunch in there. And then, like I said, I always looked and made sure that my sponge is getting wet, so it's cracked and working. All right, and then we do the basket weave on that. And so you're gonna go up and down and side to side. And that's why they call it the basket weave, because it's just like weaving the basket. Okay, and I'm gonna do that for 30 seconds. Drop that in my biohazard bag. Now I'm gonna take my non-dominant hand, reach over here and just grab your syringe that you have attached to your Huber needle and just pull that up and just give it a little shake and it'll come out there, okay? Take my sterile hand now, come over here and get my wings. Now, like I said, on the new ones, okay, you guys will, probably some of you are gonna end up with a new Huber needle in this thing. They're stiff, they're a little stiff, the wings are, so you gotta work with them just a little bit. Now, mine, I've done this like 3-4 times now, and so they're loosening up. It's getting a little easy for me to do that, okay? But you have a sheath on there, on the end of your needle, okay? So you gotta pull that sheath off then next. So get your wings back so you can hold it, and then pull your sheath off with your non-dominant hand, okay? Lay this whole thing down on your patient's chest, and we're ready to access. So I'm gonna spread my fingers out wide, like this, and come over toward my port so I don't touch the top of that port at all, okay? I'm just touching the side, okay? Mr. Chest, I'm gonna access your port now. Hold that Huber needle, 90-degree angle, right over top of the port, and just access that port. Just that easy. Lay your wings down like that, okay? Now, because of the coring possibility, we're going to aspirate 3 to 5 cc's. I always do 5. Okay, so I'm going to come back 5 cc's of blood and close my regulator. Make sure you always close your regulator before you disconnect. That keeps any air embolisms from getting in there, right? Into your tube. So now I'm going to take this off. It's trash. So I'm going to put that over there. I'm going to get my next saline flush. And this is what I'm going to flush my catheter with. So unlock it, and we do the pulsatile method, okay? Pulse, 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 all the way down. When I get to that last little bit, I'm gonna flush clamp, okay? Flush clamp. Disconnect. Now, I have an empty, okay? Nothing is in this. This is an empty syringe. Pop my top off, come over here, unclamp, and I'm going to aspirate 10 cc's of blood. Clamp, okay? Take this off. This is junk. Now, policies in some hospital may be to replace this, but this is not my specimen, okay? Because this is mixed with my saline flush. Okay, does that make sense? So this would not be an accurate representative sample. So I will put that over here, okay, is junk, right? Now, my next one, also an empty syringe. This will be the specimen that I keep, okay? So this is my another empty syringe. And when I take the cap off of this one, I'm gonna really be careful and leave it sitting upright because I'm going to recap this. Okay, did everybody get that? Everybody see? I got my cap up, the sterile part is up, okay, because I'm going to recap this in a second. So I'm going to attach this, unclamp, and withdraw my specimen. You might have needed 7 milliliters, 8 milliliters, whatever the order was, okay? So whatever the order is, get that amount. So we'll say 8. So there's 8 milliliters, clamp, okay? Deaccess here and come over here and recap your specimen. That's the one I'm going to keep. I'm going to put that over here, okay, on my sterile glove field. So I know this is junk over here. Don't mistake, please. This is the one I want to keep, okay? Saline flush. Because my patient's going home, okay? So they're just in to get their blood drawn so we can check their blood. So my patient's going home, so I'm going to flush, pulsatile method. So I'm just doing push, 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 push. When I get down to that last milliliter, I'm going to push and clamp. Okay, push and clamp. Take that off. The last thing I'm going to do is the heparin flush because they are going home, right? And so we may not access this for a month, The patient might not access it for a while at home. So we're going to heparinize it. That's going to be the policy of our hospital here. Now, let me talk just a little bit about the heparin. So, open your regulator, start pushing. And what I'm used to, now this could be different for different hospitals, but what I'm used to, okay, get down to that last little bit, push and clamp. Okay, leave it on. Just leave it on there. Okay, because we're at deaccessing, right? We're going to deaccess. But with the heparin, this is what I'm used to, 100 units per milliliter, and do 5 milliliters for a total of 500 units of heparin, okay, for a central line portacath. All right, so I'll say that one more time. 100 units per milliliter. Where I worked, we flushed with 5 milliliters for a total of 500 units. Don't forget to sign that off, okay? That's a medication, right? That is a medicine. So sign that off your MAR. Don't forget, okay? Make sure you do it. All right, so then the next thing I'm going to do is I'm going to come over here. Again, I'm going to spread my fingers far apart, come over and grab the port there. We don't have much dressing on, right? We don't have much dressing because we're just accessing, getting the specimen, deaccessing, they're going home. So I didn't have to tear anything loose, okay? And I'm just going to grab my wings here, put my hand down on their chest. Mr. Chest, I'm going to deaccess your port now. Just roll your hand back, okay? You've deaccessed it. This is a dirty needle, so it goes in your sharps container. Okay, but I'm just going to put it right there. What we want to do is take an alcohol prep pad, tear that open, and just come over here and just kind of give that a good little scrubbing right there, okay, with that. So we disinfect anything around that. And then we will have, I think I actually put it back in here. You want to, in this case, you would just get a sterile tube or two and open it up, right? You just have a sterile tube or two opened up because we don't have this kit. Well, in this case, you would have the kit, but in any other time, you might just get a tube or two and deaccess it. But you're going to lay that over there. You're going to take a piece of tape, go across it with a piece of tape. If your facility requires the bio-occlusive dressing on, then you can just put the bio-occlusive dressing, okay, and send them home. That's the skill. That's what you will do.